Welcome to the St. John's Hospital in Santa Monica online preoperative joint replacement class. This is Dr. Andy Young, and I'm here with Jordan Spiegel, and we're just going to go over the process to help you better prepare for your upcoming joint replacement.
This class will go over how best to prepare you before your surgery, what to expect when you're in the hospital, and how best to prepare for your recovery at home.
This type of information is critical because we found that patients who are prepared, patients who are more informed, just tend to do better. So make yourself comfortable, settle in, pull out a notebook. We're going to go over a lot of material. And again, because this is online, you can always pause, rewind, and listen again.
The agenda for this class will include nursing, physical therapy, occupational therapy, as well as discharge planning.
So before we get deep into the woods with preparing for joint replacement, we'll just step back and just look at basic knee anatomy and hip anatomy. So on this slide, we see a normal knee, bone, muscles, tendons, and ligaments. And the fundamental problem in arthritis is that the cartilage, the soft part at the surface of the bone, wears out, and then the knee becomes mechanically dysfunctional. And so what we do is we replace that arthritic cartilage at the surface of the bone with a new cushion to absorb the impact. So the knee is still preserved. You can still see bone, muscles, tendons, ligaments, but now there is a cap and a cushion between the bones, protecting the bones from grinding together. In much the same way, hip anatomy is very basic, but instead of a hinge joint, we consider the hip joint a ball and socket. When a hip becomes arthritic, when the cartilage erodes, the ball grinds into the socket and the hip becomes painful and dysfunctional. So what we do is we replace that ball and socket with an artificial ball and a new cushion. Once that bone is no longer grinding, once the artificial hip is in place, that bone will feel so much better and the leg will function again.
So, one of the most common issues that brings patients in to have a hip or a knee replacement would be osteoarthritis, the normal wear and tear on your bones that comes with age. Another issue might be rheumatoid arthritis or an injury in your previous days that led to traumatic arthritis, also congenital deformities. But the bottom line is pain has limited your activity, and we want to get you back to doing some of the things that you've been missing out on. So, in following slides, we'll discuss some of the activities that you can get back to doing.
So one of the biggest questions that patients have when they come in before surgery is, what will I be able to do? What are my limitations after surgery? And so this is a key slide because we want patients to understand that the whole point of having surgery is so that they can restore function, so that they can restore their lifestyle and get back to being physical and active, get back to exercise and all the things they enjoy doing. So Jordan, take us through some of the activities that we expect patients to get back to after they've gone through surgery and recovery.
Walking is going to be the number one most important activity that you do after surgery, and you will do that just in the few hours right after your surgery is complete. Recreational biking on an indoor bike is acceptable. Golfing, swimming after your incision is healed up and you're able to be submerged in water. Hiking, dancing, and driving is okay after surgery, after a few weeks.
Yes, and we put all this in context because it really depends on a person's physicality, their body habitus, their coordination, their level of motivation. So if a person comes in, they've never exercised their whole life and they just want to be able to walk to the store and see their grandkids, then that's great. But if a person comes in and maybe they were a recreational athlete and they want to get back to hiking on the weekends or playing tennis at the club or just sweating at the gym, that's great too. And if a person is a highly competitive athlete, maybe they were a former professional athlete, maybe they're still competing at the master's level, well, we want and we expect that patient to return to that same level of athleticism and physicality, right? So the whole point is to restore function to the joint so that that joint is no longer the limitation to your well-being. So one of the big keys to a successful outcome is just preparing yourself for surgery. What does that look like, Jordan?
So, since this is an elective surgery, you have the luxury of being able to be as ready as possible. Taking care of yourself, just in general, staying away from sick people, hand hygiene is really important as well. If you have any dental work that can't wait for 3 months after your surgery, please get that done before you come in for your surgery, because you have to wait for 3 months afterwards before you can return unless it's an emergency. If you have any specific healthcare issues, definitely speak with your primary care provider to address those issues before your surgery. And then on the hospital side of things, you will get 3 calls before your surgery, which typically happen the day before your surgery. If you're a Monday surgery, some of these calls might be on Friday and some on Sunday. So the registration nurse will call you so you can get pre-registered. They deal with more administrative issues such as insurance. The pre-op nurse will then call you, and they tell you what time your surgery is going to be and what time you need to be here at the hospital. They'll also tell you what time you need to stop eating the night before, what medications you're able to take before your surgery, and so on and so forth. And then the anesthesiologist will call to introduce themselves, and they can start the conversation about the different types of anesthesia that are available for you.
That's great. Let's unpack this a little bit more. So when we talked about patients about preparing themselves prior to surgery, they really want to be proactive. They want to do whatever is possible to make sure that they get the best possible outcome. So when I see patients in the office, it's usually about trying to get people as healthy as possible. And most of the time, that's just minimizing their toxins. So patients who are smoking, we're going to ask them to stop smoking. And for patients who are drinking excessively, we're going to ask them to cut back or to stop. We're just trying to get the body as clean as possible. A lot of patients ask about working out prior to surgery. They want to get in shape or they want to try to lose weight. We say, that's great. We know it's really hard to do when the joint is dysfunctional. Right? That's why they're having joint replacement. So we say, do the best you can. Don't torture yourself. Just try not to gain any more weight. The issue with the dental work, everybody always asks about the teeth, it's just because the teeth are a special place. The mouth has a lot of strep and bacteria, and so we would just want to get that cleaned up prior to any elective surgery. And the health issues are just about making sure you're in the best possible health. Most of our patients are older. They have pre-existing conditions. We're just trying to manage them better, so get your diabetes under good blood control, get your diabetes under control, blood pressure under good control, just thyroid under good control. Just talk to your primary care doctor just to make sure that all your systems are in the best possible shape prior to surgeries, because it's just going to make it easier for you in recovery.
We also want you to be as prepared as possible for your recovery period at home. This involves having someone around to help you if possible. Most of our patients who come in for the surgery are independent, and we anticipate that they will be independent when they go home. However, it is nice to have some help here and there to do certain things. So you don't need help at home for 24 hours a day, 7 days a week. Just a couple of hours for the first week or two should suffice. Also, if you can have that person available to spend some time with you in the hospital, to be there for a physical therapy or an occupational therapy session, that will be of benefit to you as well. Also, before surgery, hopefully you've reviewed your insurance policies. You know what any costs are to you. You might get a call ahead of time from the billing department at the hospital, so you can be on the lookout for that. If you're the person who tends to do the grocery shopping or preparing of meals at your house, it's ideal to make a stop at the store before your surgery and stock the refrigerator and the freezer with meals so that you don't have to stand in the kitchen and prepare things after your surgery.
So having help at home can look like many different things depending on your life circumstances. Sometimes it's a family member, it's a spouse, sometimes it's children that can help out. Sometimes it's just a friend or a neighbor who can pop by and just check on you. It's not somebody holding your hand for 24 hours a day. It's just somebody who can just check on you, maybe do some errands for you if you need something, pop to the pharmacy if you need something, just somebody to help out. And if that's not available, just making plans. Maybe you're going to hire somebody to just stop by and get a professional caregiver. Jordan?
That should be it to prepare yourself. When you come into the hospital, we want you to take off all your jewelry, leave all your valuables at home that you don't need while you're here. You shouldn't have cigarettes. Hopefully, you're not smoking when you come for this surgery, but you don't really need any money or valuables while you're here in the hospital. Things that we do want you to bring include an ID, your insurance card, an advance directive or power of attorney if you have one, a list of current medications written out with the name of the medication, the dose, and the frequency that you take it will be helpful. A list of emergency contacts is great. If you wear glasses, hearing aids, or dentures, please bring those in. And if you wear hearing aids, bring batteries and dentures. Bring all the stuff that you'll need to go with that, the paste and the cleaners. If you have a cell phone, you're more than welcome to bring that here. It won't interfere with our equipment, and we do have free Wi-Fi that you're able to utilize. If you have a sleep apnea and you use a CPAP, please bring the machine in. Our respiratory therapist will just give a once-over on the machine and say that you're safe to use that. The clothing that you come into the hospital wearing, you're more than welcome to leave the hospital wearing. You don't need to pack a bag like you're going on vacation. You just need clothes that will accommodate a new incision that you have on your hip or your knee. Shoes that are safe to walk in, that won't interfere with walking with physical therapy. It won't trip you up. You're more than welcome to bring a bathrobe if you want to. We have plenty of hospital robes that you can wear while you're here. Credit card you'll need for insurance deductible when it comes to leaving the hospital and getting your prescription filled. We advise that you have your prescription filled at one of the pharmacies nearby that deliver to the bedside. They'll just need a form of payment if you have copay due. And then a towel, this is for physical therapy purposes. They will use a rolled up towel to do some exercises with you while you're here. If you want to have that replicated to do at home, just bring a regular bath-sized towel and they will do that for you.
So Jordan, so many of our patients with pre-existing conditions are already on medications. How should we be handling, or how should they be handling medications once they're in the hospital?
We advise that you leave all of your medications at home. We have 99.9% of most medications or some substitute for that medication. However, there are certain instances where it might be beneficial for you to bring in your own medications. Like if you've had a hard time getting a medication from your pharmacy, if it's really unusual or crucial, something that's very expensive or something that's compounded and made especially for you. Also, if you take a name brand of a medication and you can't take the generic form, please bring in those medications. If you do bring in your own medications, please bring it in the original bottle that you got it from your pharmacy in, and it can't be expired. What we'll do then, our protocol at the hospital, is to have our pharmacy verify it. They'll put it in a bag with a label on it, and then we'll dispense it to you. We don't want to leave any medications at the bedside. This is just for your safety. We don't want anything that's going to interfere with the medication that you're prescribed while you're here, and we don't want you to get double dose accidentally of any medications that you normally take. This also goes for over-the-counter medications. We don't want to keep anything at the bedside. If you need a Tums or a Tylenol or something of that nature, we can get that ordered for you and we'll administer it to you. So we also want you to stop taking certain medications before your surgery. So I'll let Dr. Yoon explain that a little bit more.
Yeah, so we're just trying to minimize the effects of bleeding. We know that patients are taking anti-inflammatories, or maybe they're taking herbals or supplements just to feel better, to maintain overall health. But a lot of these medications prolong bleeding time. They make it harder for the blood to clot. So we just ask patients to cut back on these medicines starting a week before surgeries, just so that we can minimize the risk of increased bleeding.
So for pain control before your surgery, if you typically take something like Advil, we want you to stop that, but Tylenol is okay if you need over-the-counter pain control. All other medications that you normally take are fine to continue taking. If you take a prescription pain medication like Percocet or Norco, continue taking that, and all of your other medications like for blood pressure and cholesterol and so on. Once you get through your surgery, you're going to wake up in the recovery room, which is also called the PACU, or post-anesthesia care unit. So how long you're there depends on what kind of anesthesia you had and how well you're feeling when you wake up. Typically, it's about 2 to 3 hours that you're down there before you make it up to the orthopedic unit. They're going to make sure that your pain and your nausea are well controlled before they send you up to us on the orthopedic floor.
Yeah, so PACU stands for post-anesthesia care unit. It's also called the recovery room. And so a couple key medical things happen there. We will be doing our neurovascular checks. The physician and the anesthesiologist will make sure that you're safe and you're stable. The nurses will help you with pain control. And then also, it's a relational time or a social time. This is where your family can come in and they can visit with you, and the nurse will communicate with your family to let them know that you're doing fine. Once you get green lighted here, once you get checked out, once you've had a little rest and you're comfortable, we're going to send you up to the orthopedic ward.
So on the orthopedic unit, we have very lax visiting hours. Our front doors are locked at 8:30 p.m. and unlock at 5 a.m. So if you have anybody who's going to be coming or going, they can go in through the emergency room. But you're more than welcome to have one person stay the night with you. Our rooms can accommodate that easily. We're going to be coming in and out that first night after surgery to check your vital signs frequently and make sure that you're stable. We're going to do neuro checks, which means we're going to check the pulses on your feet, make sure that the sensation has returned and that everything's feeling normal. We'll check any lines that you have, make sure that your IV is running properly, and then we're also going to check your circulation aids. So your circulation aids are twofold. You're going to have a pair of compression stockings on. They will be on both legs regardless of which leg you had surgery on, and you'll also have SCDs, which stands for sequential compression device. So that's a wrap that goes around your lower leg. It will be attached to a machine at the bottom of your bed that will inflate and deflate to help push your blood around and increase your circulation. Those will only be on while you're here at the hospital. The stockings will remain on once you go home. You'll also have at your bedside an incentive spirometer. This is to help encourage deep breathing and coughing. You'll have really great pain control from the nurses, which we'll talk about in a future slide. And then we're also going to have ice on you. So we have standard ice packs. They're reusable and disposable. You can take them home with you if you want to. And there are also the options to get either gel packs or an ice machine, which is something that you can inquire about when you're here at the hospital.
And just three special things about the orthopedic ward. One is that all the rooms are private. So you'll be able to go through this recovery very privately. There is a daybed in every room, so a loved one or a caregiver can be there. They can hold your hand. They can spend the evening there with you. Also, as a specialized orthopedic floor, it's important to know everybody there. It's not just the physicians and the nurses, but everybody there is an expert on joint replacement. Everybody there knows what they're doing, and that goes from the case manager to the nursing assistant to the physical therapist, occupational therapist. Everybody is there for the sole purpose of helping you through your recovery. And then finally, it's important to know that the point of the orthopedic ward is for observation, health, and safety. And so it's not a hotel room. We'll be doing neurovascular checks, and we'll be doing constant periodic assessments. So we will be waking you up in the middle of the night to make sure that your vitals are okay and that you're safe and stable. Right? So don't expect to get a good night's sleep in the hospital. We want you to rest, but we're not going to let you sleep all night. It is our mandate to check on you to make sure that you're doing well. So I want you to understand that ahead of time. We take really a team approach to perioperative care. So there's physicians, there's case managers, there's therapists, and really one of the stars of the team is nursing.
So you'll have a nurse that's assigned to you each shift. They're the ones who will help to coordinate your care. So they'll be talking to the physicians, talking to the pharmacy, and talking to physical therapy and occupational therapy. You'll also have a nursing assistant, and they're responsible to help you with your ADLs, which stands for Activities of Daily Living. So that's simply your daily routine, getting up, getting dressed, getting to the bathroom, washed up, brush your teeth. If you want to go for a walk in the hall, they can assist you with that.
Yeah, and it's important to know that these are specialized orthopedic nurses. So even nurses specialize much the same way physicians specialize. They're cardiac nurses, they're surgical nurses. These are orthopedic nurses. They often have orthopedic certification, and this is all they do. So they will be able to guide you through this. They will be able to answer almost all your questions. They're going to be able to shepherd you through this process while you're here.
And they are well educated on how to get our orthopedic patients up and moving, which is helpful. So the best way to get a hold of your nurse or your nursing assistant while you're on the floor is to use the call light. It's always tempting to send somebody out into the hall to flag somebody down to come in and help you, but if you need assistance, just put your call light on. We'll be in as soon as we can. Our goal is to keep you as safe as possible while you're here, so we don't want you to get out of bed without our help. That's why the call light is very important. Which brings us to our next slide, which is all about fall prevention. Our goal is to keep you as safe as possible, and our motto is call, don't fall. So we have signs in your rooms that will remind you to call for assistance when you're getting out of bed, or if you're in the bathroom, to call when you're getting up off the toilet. So we will do everything that we can to make it as easy as possible for you to get a hold of us, which means that we'll keep your call light by your bedside. We'll make sure that any of your personal needs or your personal items are kept within reach, like your cell phone in particular. And then we're going to make sure that your room is as clean and tidy as possible, so that there are nothing in the way that can trip you up, like cords or dirty laundry. No clutter in the way.
Also, pain control will be a huge part of your postoperative recovery regimen. And we do a lot to manage pain at several different levels physiologically. So orally, at the level of the joint, and regional blocks. So specifically for total knee patients, many will have an adductor canal block. It's a specific block targeting the saphenous nerve, which is a sensory nerve, and it is extremely effective in decreasing pain during the acute period. It lasts for several hours. But while this block is working, the leg is going to feel a little numb. It's going to feel a little tingly, like it's falling asleep. And we expect that because we're numbing it. So that's a sign that it's working. But while this block is working, some people can have some muscle weakness in addition. It may not be a pure sensory block. So we really ask our total knee patients to be very careful. We're going to put a sign. We're going to put alarms. We're going to put a belt. The block doesn't last that long, but we're going to just take extra precautions while your leg is numb and tingly during the period of the anesthesia.
Yeah, so to go back to the previous slide about fall precautions, we're going to do everything that we can to keep you safe. So please call us, especially the first 24 hours after surgery, so that you're not getting up on your own.
Yeah, so managing pain is one of the most critical aspects to a successful recovery. Everybody is so concerned. I think that's the reason people wait so long before they get their joint replaced, just because they're afraid of recovery. We understand that, and that's why we spend so much time managing this, why we're so proactive about it. The first thing that we do is we assess. So before we get to how we manage it, tell us a little bit about this chart that we have here with the smiley faces and the unhappy faces.
So we use a pain scale. It's a 0 to 10 pain scale, and you have the faces in front of you that help to so that you can choose where you are if the numbers aren't that easy, because many times patients, it's a very subjective thing. They can't know exactly what number their pain is, but the faces help a great deal. So 0 is no pain, 10 is the worst pain possible. Our goal is typically to keep our patients at around a 3 or a 4 out of 10 on the pain scale. This is where it's a mild to moderate pain and they're still able to do their physical therapy and do most normal activities.
Yeah, and the whole goal of, I think, pain management is specifically to manage pain, to make pain tolerable. It's not to eliminate pain. I think we can run into the issues of over-medication if we try to make the pain go to 0. We're trying to make the pain tolerable so that a person can function, they can walk, they can do their therapy, they can talk on the cell phone, they can watch TV, just so that they can function. It's also important to know that that pain level is going to fluctuate. It won't stay at the same level. So if a patient lying in bed, they're going to be more comfortable. But when they're doing their therapy, when they're more active, when there's more stress on the joint, we would expect that pain level to arise to a 6 or a 7. And that's okay, because we're starting to work the joint, which is just as important as pain control.
So it's much easier to stay on top of the pain control by treating it when it's at a lower level. So we don't want you to wait for the pain medication until you're at one of the unhappy faces. We want to treat you at a 3 or a 4 or below if we can. So we're going to keep on top of it. Most pain medication is due every 3 hours or every 4 hours, depending on what the medication is. So you'll work with your nurse to create a good schedule that works for you. And also we want to medicate you prior to working with physical therapy. So it's ideal to take a pain pill at least an hour in advance of working with them. So your nurse and your physical therapist will coordinate to ensure that you're on the best schedule for that. We say to eat a light snack or crackers with your pain medication. It can cause some stomach upset, so we want to try to eliminate that as much as possible. So having something in your stomach will help to do that.
We are very aware of issues of pain control. we know that surgery hurts. It's surgery. And so pain is just a natural part of recovery. It's an important part of recovery. It's how the body is designed to protect itself after it's been exposed to surgery or injury. So it is natural. It is not dangerous. But we still want to try to manage pain. We will be very aware of patients' pain. That's why the nurses will be asking you, I'll be asking you, the pain pharmacist will be asking you, the intensivist will be asking you, we'll all be asking about your pain. We want you to be comfortable. But again, the whole goal is to make pain manageable, not to eliminate pain. And again, this will be very much of a feedback process because there is so much individual variation. Some people will have a tremendous response to pain medicine. Some people will get severe nausea and itchiness. Some people will take pain medicine and their body's so used to it, it will have very little effect. And so we'll have to observe, titrate, and keep iterating till we find what's most effective for any given patient. So Jordan, after surgery, the leg is different just because they've had surgery and there's a new joint. The leg is now mechanically different, better, structurally improved, but different. What are some of the things that patients can expect that are normal, but they can expect afterwards?
So inflammation and swelling is to be expected after a surgery like this. So some of these sensations might be related to that. So you might feel like your leg is heavier. For my knee patients, you might feel like there's a band around your knee just due to that swelling, and it might just feel tight all over in the leg. You also might feel like your leg is a little bit longer. They will take great care in surgery to ensure that you are as even as possible. So if you feel a little bit longer, it might just take a little bit of time to adjust to that new joint. You might have some warmth around your incision site, and there might be some light redness. This is a natural part of the inflammatory response in the body, so we expect that. You might have some numbness along the incision site or on the side of your leg or side of your thigh or your knee, and that's just a consequence of cutting skin and having those nerves cut as well. So over time, you will regain sensation. And you might have some bruising as well. Bruising might not show up while you're here in the hospital. It might take a couple of days to show up, but you will have bruising. It'll turn every shade of the rainbow, and that is totally normal.
Yeah, let's talk about what's happening at an anatomic level. So these are the symptoms that a patient will feel right after surgery. Anatomically, what's happening is that after surgery, the connective tissue is healing together. The sutures are healing, the soft tissues, the connective tissue, the joint is adapting. And so it does that through a process of inflammation, which means the joint will be inflamed. It will be hot, it will be red and warm. This is not an infection. This is inflammation. And it's a necessary physiologic part of the healing process. And it's important to be aware of it so that when you see that your leg is red, hot, and swollen, you're not scared by it. And so be prepared to see that. It's a normal process. We'd actually be concerned if you couldn't generate that inflammatory response.
So as nurses, we are frequently asking you if you are passing gas after surgery. We're not trying to be crude or rude. We are trying to see that your insides are starting to work after surgery. So we want to make sure that after anesthesia and then you throw pain medication on top of that, that your bowels are waking up. So the first precursor to a bowel movement will be you having gas. So there are things that you can do naturally to help avoid constipation, like eating foods that are high in fiber, fruits, veggies, whole grains. Drinking 6 to 8 glasses of water a day is really important to keep your bowels lubricated. People tend to restrict what they're drinking after a surgery like this because they don't want to get up due to pain. But I highly recommend drinking enough water that'll help you with not only urinating, but also having a bowel movement. We don't want you to go any longer than 3 days without having a bowel movement. So you're going to be home by 3 days, so we want you to keep your eye on this once you're home and also have a stool softener on hand. We'll give you stool softener starting here in the hospital, but as long as you're taking a pain medication or a narcotic, please continue taking a stool softener. You might also want something a little bit stronger on hand in case a stool softener isn't working and you get to that 3-day mark and you haven't had anything happen. So whether that's milk of magnesia or anything else that you like to use, you might want to have that on hand as well.
Right, and patients with constipation or who have issues with constipation know who they are. They've often been dealing with this for a long time. They have all the tricks and medicines already in their medicine cabinet. But some of the things that we recommend for patients are Miralax. That seems to be very effective. Milk of magnesia, magnesium citrate, or some of the other bulking agents like Metamucil. Uh, Sleeping after surgery is tough. Like I said before, you're not going to get a great night's sleep at the hospital. The hospital is for observation, health, safety, and risk assessment, not for rest and relaxation. But even after you get home and you're in your own bed, sleep is still tough. Um, the sleep cycles are different after surgery. There's a change caused by the inflammatory cascade after surgery, which is going to affect the circadian rhythms. Sleep will be different. You may find yourself napping if you've never napped, and you might find it's hard to either fall asleep or stay asleep. Jordan's going to talk to you a little bit about sleep hygiene and trying and different ways you can try to optimize that. But it's so important. I know you're trying to sleep, but don't stress over this. Don't stress, because once you start stressing about trying to fall asleep, it makes it even harder. Just know, very importantly, that if you're just lying in bed and the lights are down and your eyes are closed, it's still 80% as good. Okay, so don't stress. It's okay to just lie down, keep your eye closed. Even if you're not falling asleep, it's still 80% as good, and that process alone is helping you through rest and recovery.
Okay, so there are some tips and tricks, things that you can do to help encourage a healthy sleep hygiene and sleep pattern. So doing relaxing activities before bedtime. You don't want to exercise too close to when you plan to go to bed. Eating foods that are high in tryptophan can help you fall asleep, like eating turkey, bananas, or milk. And avoiding things that will trigger you to stay awake close to bedtime is advisable. So avoid caffeine, chocolate, sugar, closer to bedtime. You might want to limit those after lunch. Avoid smoking always, but particularly close to bedtime. If you're somebody who tends to get up in the middle of the night to go to the bathroom a lot, we might recommend restricting the amount of fluid that you drink in the hours leading up to the time that you're going to bed. Also, for every patient, we want to make sure that you have a clear path to the bathroom at nighttime. Make sure that there's some lighting. Make sure that there's no clutter in your way, and make sure that you have your assistive device, if you're using one, close to your bed. Also, it's important to have some extra bedding and pillows available to help make you more comfortable when you're laying in bed, and also if you're going to be taking naps on the couch or wherever you are during the day. So this is easy to use for elevating your leg or turning on your side, putting it between your knees, whatever you need to use. It'll make it a little bit easier if you have some stuff readily available. And also, making a routine and regular exercise will help to deepen sleep. So this is going to be your physical therapy for those first couple of weeks and months after surgery. And if you have persistent problems, let your doctor know. But like Dr. Yun said, this is something that we anticipate, and it'll take some time for it to get back to normal. So
Another thing that people talk about as difficulty falling asleep has to do with the fact that their joint hurts. And so pain control before bedtime can be very helpful. Some patients are still taking a pain medicine before they go to sleep at night to help them fall asleep and to help them stay asleep. In terms of dealing with inflammation, some people find it effective, and everybody's different. You're going to have to figure out what works best for you, but some people find it's effective to ice their joint before they go to bed. And then some people have found it effective to use a supplement such as melatonin. Now, this is not a sleeping pill. We do not advocate sleeping pills. This is melatonin. You can pick that up at Trader Joe's or a pharmacy or any store, and sometimes it just helps smooth out the sleep cycles that are affected.
taking care of your incision is one of the more important things you're going to be doing when you go home, as infection is the number one complication of any joint replacement surgery. So we want you to keep your incision as clean and dry as possible. You'll go home with a dressing called a Mepilex border dressing when you leave the hospital. We like you to keep it covered for 1 week after your surgical date. After that time, you can leave it open to air. You're able to shower when you go home. We just want you to stand with your affected side away from the forceful stream of the shower. So if you had your right leg done, stand with your left side towards the shower. We don't want you to scrub the incision. You can let the water and the soap run right over it. After you're out of the shower, you can just pat it dry. Don't rub it too hard. We don't want you to put any creams or ointments over the incision until your incision is healed fully. And we don't want you to be submerged in any water. So no baths, pools, jacuzzis, ocean, anything like that. You'll have steri strips under the bandage that will stay on your skin and so you just let them fall off on their own. If you happen to have them on when you go for your follow-up appointment, we will most likely take them off at that time. And then for further down the road, we don't want you to expose your wound to the sun. This is for healing and scarring purposes. So when you're able to, you can put sunscreen on if you're going to be exposed to the sun.
Yeah, so we try to do a cosmetic closure on every patient. We don't use staples just because we don't think they don't look as good. Everything is done cosmetically on the inside. These sutures will dissolve over 8 weeks, but it will look lumpy because it will go through a process of dissolving while the scar is maturing. And we actually have a video online on how you can physically take care of your wound after surgery. So getting ready for discharge begins way before surgery. It actually is part of the preparation process. It begins before you get into the hospital. And it means doing things like Jordan talked about, preparing your home, identifying who's going to drive you to the hospital, who's going to drive you back from the hospital, and who's going to be helping you with needs and issues once you get home.
So the time of your discharge, it varies greatly. There's a lot of things that need to happen before you are able to leave. So first and foremost, the medical doctor, your internal medicine doctor, will write the discharge order and write the prescriptions for you to go home. That order will say that once physical therapy has cleared you, you're fine to go. So physical therapy will see you. So depending on if they see you in the morning and if they think that you need another session, that might push it a little bit later in the day. But once they say that you're safe, you're able to go. Case management should see you. They'll set up any home needs that you have. If you need PT set up at home, they will do that for you. We will get your medications filled at one of our pharmacies nearby so that you'll have the medications in your hand to go home with. We will change your dressing the day that you leave the hospital and give you some extra dressings to go home with and make sure that you're comfortable with how to change that on your own. And if you need medication, pain medication, before you leave the hospital, we will give you another dose. However, once we give you a pain medication, we have to keep you for an hour just to monitor you. So once all of those things are complete, then you're able to discharge home.
So we know that after surgery, the joint is going to be inflamed, like we talked about, red, hot, and swollen. Patients will be achy, sore, they'll be tired, they'll be fatigued. All that is just a natural part of surgery. So given that we know that a patient is going to feel off, different, sore after surgery, are there any particular warning signs they should be aware of?
So we want to look for a fever or a temperature that's greater than 102. We anticipate some mild low-grade fevers. That's okay. If there's anything draining or oozing out of your incision site, that's something to call the doctor about as well. Intolerable pain, please let your doctor know. We do anticipate some levels of pain, but if it becomes intolerable, call us. And any other medical issues like chest pain, shortness of breath, or a urinary tract infection would be cause to call the doctor. So you can page the answering service if it's out of hours, and we will return the call.
Okay, switching gears, we're going to start moving into physical therapy and how to move the joint and what to expect.
Okay, going back to the fact that this is a elective surgery, we want you to be as prepared as possible. So this also involves preparing your house for surgery. So we want it to be safe because you're going to have an ambulatory assistive device, whether it's a walker or a cane, when you go home. So make all areas safe. We want you to get any loose rugs, little area rugs, bath mats, kitchen mats off the floor. Make sure that there are no cords or wires on the ground or clutter that can trip you up. Secure pets. This is particularly important when you first get home. We don't want them to be jumping all over you. So if you can put them outside or put them in another room, that would be great. Make sure that the kitchen, bathroom, the bedroom, the areas that you're going to be spending the most time in are prepared for you.
Yeah, so after surgery, you're going to be medically okay. You're going to be surgically stable. You'll be comfortable. Our biggest concern, your biggest risk, is falling after surgery, and that's why we spend so much time. So this amount of prevention is completely worth it in trying to create the safest recovery possible.
So you can assess the need for rails. We don't anticipate that you'll need to install any when you go home, but if you have any stairs that might need railings, this is something you can look at ahead of time as well. We want you to check any equipment that you already have. If you have a walker or a cane that you're going to be using, we want them to be in good working order. We don't want them to be rusted shut or have the rubber on the bottom worn through. A vehicle for the ride home. You can really go home in any car. It's easiest if you have a normal level sedan, not a really low sports car or a really high SUV. It's just easier for you to get in and out of. And then chairs when you're at home, we advise you to stay away from any chairs that have wheels or could roll away from you when you go to sit down. Chairs that have armrests are usually the easiest for patients to get in and out of.
One of the key elements to a rapid recovery is early mobilization, and that actually starts on the day of surgery. It is so important on the day of surgery to get all your systems going. So after a period of rest in the recovery room, we will want you to start working. We want you to stand and walk. The physical therapists and the nurses will be encouraging you to get up and move. And I know you're going to feel like, I can't do this, but we will teach you how to do this. And every time you get up, your confidence will build and it will get easier and easier.
So, with that being said, we want you to get up with our assistance, but we don't want you to get up on your own until physical therapy has cleared you and says that you are safe to do so. So, they'll get you up that first day, but we want to help you until they say you're safe. So, if you need to get up, call your nurse. If you're having pain, nausea, or lightheadedness, just let us know. We want to keep you safe, and as we've mentioned before, we don't want you to fall, so we want to make sure that you're in good working order before we get you up and moving.
And for you type A, aggressive and athletic people, remember, this is not a race. It's not a contest. It's all about safety, and it's okay to go slowly in the beginning. And for those of you who are a bit out of shape, who haven't really worked out, that's okay too. We're going to teach you how to move yourself, and we do this all the time, and you're going to be fine too. Day one is a busy day. It's a lot of teaching and training. Tell us what happens in physical therapy.
So we might have mentioned before, the day of surgery, you'll have one physical therapy session. Day one, which is the day after surgery, you are going to have 2 physical therapy sessions. So you'll have one in the morning before lunch and one after lunch. So they will get you up and walking around. They're going to give you a list of exercises. This is your home exercise program. So it's a handout that has pictures on it, and they'll go through how to do each exercise so you're familiar with it. So these are specific exercises depending on a hip or a knee and depending on who your doctor is. So we have specific exercises for Dr. Yoon. And then, like I said, you'll have 2 physical therapy sessions, so you will be busy.
Yes, and we want you to approach this mostly as a refresher or as fine-tuning, because we want you to take the time to learn how to do your physical therapy prior to surgery. And there are a lot of resources. We'll give you a prescription ahead of time so you can do prehabilitation. You can learn how to do your exercises, how to go up and down stairs, how to use a cane or a walker. There are also resources we put online. We videotaped our physical therapist that can teach you how to do all this stuff online. You can watch those over and over again. So we really want you to get this down prior to coming in, so as soon as we're done with surgery, you're ready to get going. You already know how to do the exercises. And the role of the physical therapist is just there to coach you, to look at your form, and to encourage you and support you and make sure you're doing them correctly while you're in the hospital.
So what's showing here are some of the examples of the knee exercises that we have for our patients. So you can look these up online if you want to, but we'll give you the handout when you're here in the hospital so you can see how to do each and every one of these.
And don't be intimidated by this list. These are exercises specifically designed for neuromuscular coordination, for circulation, and for toning. And even though it's a long list, it's not going to take you more than 15 minutes to go through a set of these.
And again, here are the list of exercises for our hip patients. Pretty self-explanatory. So we have some special equipment that will be on the orthopedic unit for you to use while you're here. Specifically on the bed, there will be a trapeze and bed rails that will help you to move around and adjust and reposition yourself while you're in bed. We want you to reposition yourself every 2 hours. You'll get really sore and stiff if you stay in one position for too long. It's also advisable that you do ankle pumps while you're laying in bed. That will help with your circulation to prevent blood clots. When physical therapy is working with you, they'll ask what your home setup is like so that they can replicate that as close as possible. This is particularly important when dealing with stairs. We want to ensure that you're safe to manage stairs when you go home, so they'll do stair training with you. So look at where your railing is for your stairs, if you have a railing, what side it's on, and they'll help to replicate that. So they will get you set so that you're safe when you go home. Other orthopedic equipment and assistive devices that we have while you're here, we'll try you out on a walker. If you don't need a walker, we'll go to a cane. We're going to make sure that you leave with the equipment that you need for safety. So we don't typically have patients on crutches, so it'll either be a walker or a cane.
And again, remember, this is all fine-tuning and coaching. So the key point here is that we already want you to have learned how to do these exercises prior to surgery. So, and again, there are so many resources. We'll have you visit with your neighborhood physical therapist. You can look at resources online. You can come into the actual real class, and Jordan and our physical therapist can teach you how to do this kind of stuff. But we want to take away the mystery of physical therapy prior to surgery. We want you to be completely comfortable so that all we're doing is refreshing you and checking out your form.
So there are a few things that we will focus on to get you ready for discharge home. So we want to make sure that you're able to get in and out of bed independently. If you're not able to do that independently, we will hopefully have somebody there, one of your friends or your family, loved ones, who will be able to help you with a little bit of assistance. We're going to make sure that you're able to walk comfortably, and we'll give you your home exercise program, which you should do 2 to 3 times a day as you're able to. We're also going to make sure that you're able to go up and down stairs, get in and out of a car. We're going to do any activity modification that you might need, and we'll talk to you about any possible precautions that you have related to your surgery. So you will graduate from PT, and they will clear you to go home when you are able to walk at least 50 feet or more, when you have adequate pain control with walking and with exercises, when you have a sufficient range of motion, which is just the bend of your knee or your hip, and when you demonstrate that you have knowledge of your home exercise program. It's important that you listen to your physical therapist, because they're the ones who will clear you and give you the go-ahead that you're safe to leave the hospital and go home and be on your own. If you don't make sufficient progress with physical therapy, they might make a recommendation for home physical therapy or to transfer to a facility with rehab services. We don't anticipate a need for rehab services at another facility. Most of our patients go home either independently or with some home physical therapy a couple times a week.
And remember, the therapy doesn't stop once you leave the hospital. It is something that you will continue doing. For most of our older patients, we will actually have a therapist come visit with them to make sure that they are making progress and that their form is good in their therapy. For some of our younger patients who are much more independent, they'll be able to start outpatient physical therapy much earlier.
Occupational therapy is a brother-sister specialty with physical therapy. They help you with some adaptive tips and tricks that can make some of your daily routine a little bit easier to get through. So as we mentioned earlier, physical therapy will see you twice a day starting on the day after your surgery. Occupational therapy will start seeing you on that post-op day 1 as well. So you'll have 2 physical therapy and 1 occupational therapy sessions. So that's 3 total. They'll see you once a day. They might only need to see you that one time of the first day, and that's it. Otherwise, they'll see you once a day any subsequent days after that. They'll help you to be able to wash up, get dressed, sit at the edge of the bed, go to the bathroom, and they'll talk about any adaptive equipment that you might need to go home with that can make some of these daily activities a little bit easier for you.
And remember, the program for joint replacement is designed for independence. We want you to be able to be by yourself. We want you to be able to take care of yourself. And so the occupational therapist is a key part of that instruction. Again, they will give you the tips and tricks. We have learned how to help patients take care of themselves, and they're going to be an important part of that process.
Our goal is to send you home as organically as possible, so we don't advise you to buy any equipment beforehand, before your surgery. We will have all of the equipment here in the hospital for you to trial, and we can have it ordered for you here and send it home with you if you do need anything, and we'll go over that equipment in the upcoming slides.
Yeah, I think a lot of patients are surprised that it's not as complicated as they thought it would be. So joint replacement's been around for 40 years, and 20 years ago there was just all this equipment that you needed, like pillows and toilets and all this gear, but it's a lot simpler than that. And I think you'll be surprised at how well you'll be able to move even the first 24 hours after surgery.
So this first slide with equipment shows things that can be used to help with toileting. So on the left, you'll see a 3-in-1 commode. This has 3 uses. It can be used as a commode next to the bed with a bucket underneath. It can be used to go over the toilet, and it can also be used with the seat down as a shower chair. So if you need help with toileting, this is one of the OT's favorite pieces of equipment because it touches the ground at 4 points. It's got arms. It's very helpful. However, you won't need it as a 3-in-1 commode. You'll only typically need it as over the toilet because patients can walk to the bathroom with no issues. You don't need this at the bedside. Another option for toileting is just a raised toilet seat with arms. This simply attaches to the toilet bowl and will help you if you don't have railing or anything to push off of when you're getting off the toilet at your home. The other option is just simply a raised toilet seat that replaces the toilet seat that you currently have. It doesn't have any arms. If you have a vanity next to your bed, or next to your toilet, or a railing, then you don't need the toilet seat with handrails on it.
Yeah, and these are just tools and tricks or hacks just to make it easier. And these are not permanent things. You're not going to need to install these permanently. These are just tools to help you during the first phase of recovery when you're a bit sore and stiff and you're going through that post-surgical inflammatory period.
The next pieces of equipment are for bathing. So on the left, there is a shower chair, which is simply a chair that you can put into your shower. And then on the right is a tub transfer bench. So this is for our patients who have a tub and they are unable to lift their leg to step into the tub. So you simply just sit down on the chair and you're able to slide your legs over that way. It's got adjustable legs, so if you have a height discrepancy between the inside of your tub and the outside, you're able to adjust that. But these are simply tools to help you get in and out of the shower if you're unable to independently.
Yeah, Jordan, talk a little bit more about washing. So patients always ask, "Can I shower? When can I shower?" All that kind of stuff. Can you just tell them about our protocols for that?
Our patients can typically shower the day after surgery, so absolutely once you're home, you should be able to shower. As I mentioned earlier, you just want to stand with your affected side away from the forceful stream of the shower. There's no bathing in a bathtub, but you're able to have an upright standing shower, no problem.
Yeah, and we're going to teach you how to do all that stuff.
Yes, that is occupational therapy's job.
Yeah, so this is the adaptive equipment. I love this kind of stuff. These are the gadgets. These are these little tools that people have created to make life easier after joint replacement. And I think this is a lot of fun stuff. So go ahead, Jordan.
So on the left, being demonstrated by this lady, is a sock aid. So this simply aids in putting your sock on. This is particularly helpful for patients who don't have anybody at home who's going to be helping them put on and take off their compression stocking. So this can be used to assist with that. On the right, we have the sock aids on the bottom. Above that is a long-handled shoe horn, so you don't have to bend down and put your shoe on. And above that, we have a reacher or a grabber. This can be helpful to pick up things. You can loop it around your pants or your underwear to help pull those up. And then on the top is a long-handled sponge, so that will just help you clean your toes. If you can't bend down, reach your back. It's a helpful little tool.
I love that grabber thing.
It's very helpful.
Okay.
So you are complete with occupational therapy once you are independent, or you can get things done with minimal assistance, either with the help of somebody else or with some adaptive equipment to get some of these daily activities complete. Most importantly, we want you to be able to safely transfer to the toilet and get in and out of the shower.
Another key member of the team is our case manager. And The case manager is the person that will help you prepare for life after you leave the hospital. They're going to help you with arrangements, your needs. They're going to make sure that you're comfortable with what we call discharge disposition.
So they will set up any needs that you have once you go home. So primarily that would be home physical therapy. They will work with your doctor to use the agency of that they recommend, or if depending on where you live, they might have to use somebody that's closer to you, but they will help out with that. Typically it's just home health. You don't need anybody really to change your dressing. It's very simple to do on your own. And if you happen to be transferring to another facility, they will set that up as well. They'll give you the choice list and you can choose, and they will set up whichever place you desire to go to. Take it away.
Okay, Jordan, we are now on our last slide. Congratulations to all of you who have managed to sit through this. But I got to tell you, this is critical information, and paying attention and just taking this information to heart is really going to make your recovery a lot easier.
If you have any questions or concerns at all, my contact information is up on the screen. Please reach out. We will be happy to answer any questions that you have before your surgery. And this is something to be excited about. You're making the right decision here, and we look forward to having you in the hospital.
Yes, and again, all this information is in many different places. So it's all in that notebook that we have given you. Feel free to watch sections of this again over and over. And also, there's a real live class, so you can meet Jordan and the therapists and the nurses and the case managers and take a look at the hospital, especially if you've never been in a hospital and the idea of a hospital intimidates you. Just come into the class and you can see what happens in real life.
So we look forward to seeing you soon in the hospital. And again, please feel free to reach out if you have any questions or comments or concerns.
Thank you. Be well.